Tran. What the hell are you doing here? Emily Tran froze. Her fingers clenched tighter around the coffee she had just placed on the stainless steel counter. The OR nurse stared at her, half in disbelief, half in panic. I heard the trauma alert, Emily said. Level 1 pediatric. I wasn't scheduled, but... Exactly, the nurse snapped. You're not on call. This isn't a teaching case. You're not even scrubbed in. Emily swallowed hard. Her badge felt too big, too obvious on her chest. Intern, surgical rotation, Tran. She wasn't supposed to be here. And yet, her gut told her she needed to be. Through the small window in the OR doors, chaos buzzed like an electrical storm. Monitors beeped, a stretcher rolled in, and a blur of voices filled the corridor. Code blue, pediatric, ETA 2 minutes. Then the double doors burst open. A boy. Bloodied. Unconscious. Maybe 9 years old. A paramedic shouted vitals. BP dropping. Pupils unequal. Suspected splenic rupture, chest trauma, he's crashing. Emily's heart dropped. The nurse rushed to the comms panel. Where's Dr. Whitmore's team? Still stuck in B wing, someone called. The lockdown hasn't cleared. The nurse turned ghost white. Only 2 people stood fully scrubbed and prepped in the hallway, Dr. Marcus Whitmore, the chief of trauma surgery, and Emily Tran, an intern 2 weeks into her rotation. Dr. Whitmore stepped forward, his voice calm but sharp. We begin in 2 minutes. Where's Morris? Patel? Anyone? Still in the elevator lockdown, sir, came the reply. Whitmore's jaw tightened. He looked at Emily. She looked back. And suddenly, she realized, she was the only one left. You're not qualified for this. Whitmore's voice sliced through the prep room like a scalpel. Emily was halfway into a sterile gown, hands raised, breath shaking. I know, she replied. He didn't flinch. This is a pediatric splenectomy. On a crashing patient. With multiple internal injuries. You misstep once. And he dies. I know, Emily said, louder now. Whitmore stared at her for a second. Cold. Calculating. Then why are you still here? Emily met his gaze, something fierce lighting in her chest. Because no one else is. A beat. Then another. Scrub in. Inside the OR, the room shifted into silence. Alarms still blinked, but the chaos was focused now, contained. The boy was prepped. Monitors screamed low blood pressure. A nurse suctioned blood from his abdomen. Clamp, Whitmore ordered. Emily handed it, steady despite her racing heart. Retractor. Another instrument. Whitmore worked fast, precise. But he couldn't do it alone. He needed a second set of hands. A reliable pair. And today, against all odds, they were hers. Kidney looks bruised. Spleen's worse. Tran, keep that suction going. And retract upward. Firm, but gentle. Emily nodded, eyes locked on the surgical field. They moved together. A dance of urgency. Emily's arms burned, but she didn't flinch. Every moment tested her memory, from textbooks, from shadowing, from hours watching surgeries she wasn't invited to assist in. BP holding at 90/40ths, the anesthesiologist called. Whitmore grunted. Better than I expected. He looked at Emily. You've done this before? No, sir, she said. Only on a pig. In residency lab. He blinked. Just once. Well. Hope that pig was a fighter. 47 minutes in. The bleeding slowed. Clamps in place. Spleen removed. Internal damage assessed. The boy was stable. For now. Whitmore exhaled. Not relief. Not yet. But acknowledgement. He turned to Emily. I need you to close. Her eyes widened. Sir. You assisted. You held. You saw every layer. Time to prove you were paying attention. Her hands trembled as she reached for the sutures. Not from fear, but from the sheer weight of the moment. She'd waited for this. Earned it. And now it was hers to lose. She began. Needle. Tie. Cut. Again. It wasn't perfect. But it was clean. And when she tied the final stitch, Whitmore stepped back. Pressure holding. Let's get him to ICU. The room finally exhaled. So did Emily. Outside the OR, chaos returned. Staff ran, phones buzzed, and voices overlapped in hospital noise. But inside her, everything slowed. She peeled off her gloves, washed her hands, and leaned against the wall. A nurse passed her. You're the intern, right? Emily nodded. You just saved a life. Emily didn't know what to say. Then she heard it, low, measured, behind her. Good work. Dr. Tran. She turned. Whitmore was already walking away. It started with a whisper. By 7 a.m., the entire West Wing knew something had happened in or to the night before. By 9 o'clock, it wasn't a whisper anymore, it was a current running through the hospital's arteries. An intern. She closed the incision herself. Dr. Whitmore let her assist, solo. Are you sure it wasn't Patel? Or Morris? Emily heard the voices before she saw the faces. Nurses glanced at her twice. Residents looked at her like she had grown an extra head. One even stopped mid-sentence in the hallway when she walked past. She kept her head down and kept walking. At her locker, a note was taped to the door. No name. Just. You must have been damn lucky. Or damn good. She wasn't sure which one she preferred. At 10:17, during rounds, Dr. Leone, the surgical coordinator, called her name out loud in front of 12 residents. Tran. Conference room. Now. She froze, then nodded, slipping her stethoscope from around her neck. The others watched as she left the room, the silence behind her thicker than the air. Inside the conference room sat 3 people, Dr. Leone, Chief Whitmore, and Dr. Karen Elsner, head of surgical education. Close the door, Emily. She did. Sit. She sat. Leone folded his arms. Tell us exactly what happened during the operation last night. From the moment you entered the OR. Emily's throat dried. She began, carefully, honestly. She told them about hearing the trauma call, about showing up despite not being scheduled. About the boy. The lockdown. The team that never arrived. And finally, about how she stepped in. When she finished, the room was still. Elsner narrowed her eyes. And Dr. Whitmore? He asked you to scrub in. Whitmore's voice cut in, calm as steel. No. She was already scrubbing in before I asked. Leone raised an eyebrow. On her own. She made a judgment call, Whitmore said. And it was the correct one. Emily blinked. She had expected defense. Not praise. Elsner turned to Whitmore. And you let her close. I watched her technique. It was sound. Leone tapped a pen against the table. We reviewed the footage. Emily tensed. She was steady. No hesitation. Her retraction was clean. Clamps were efficient. Closure was slow, but precise. Whitmore added, she did better than half the second years. There was silence again. Then Elsner said what Emily feared most. This sets a precedent. Whitmore nodded. Good. By lunchtime, everyone knew. In the cafeteria, as Emily poured herself coffee, a third-year resident nudged her shoulder. Hey, Tran. When's your TED Talk? She smiled awkwardly. Just doing my job. He smirked. Right. Saving lives before your midterm evals. No pressure. Another voice joined in. Don't let it go to your head. You got lucky. She turned. It was Martha, a senior intern, and someone who had always kept Emily at arm's length. You think you're the first intern who scrubbed in during a crisis? Martha continued. Please. You just happened to be standing in the right place when the team didn't show. Emily opened her mouth, but stopped herself. Don't worry, Martha added, sipping her smoothie. They'll forget by next week. That night, Emily found herself alone in the surgical library. The lights buzzed quietly overhead. She opened a textbook, not to study, but to ground herself. To remind herself that she still had so much to learn. You're not here to hide, are you? She turned sharply. Dr. Whitmore stood at the end of the aisle. No, sir, she said quickly. Just reviewing. He stepped closer, slid a file onto the table. That's tomorrow's patient. Complex thoracic case. I want you scrubbed in. Emily blinked. Me? Sir, You earned a seat at the table. Don't step away from it now. She hesitated. What if the others are right? What if it was just luck? Whitmore looked at her, eyes unreadable. I don't believe in luck. I believe in preparation meeting a moment. He paused. And when your moment came, Emily, you didn't flinch. She didn't sleep much that night. But for the first time, she didn't toss and turn out of anxiety. It was something else now. Anticipation. The surgical board read. Thoracic, pulmonary artery repair, Dr. Whitmore, 10:30 a.m. Assistant, Tran, Intern. Emily stared at the digital screen, her name burning like neon. Is this a joke? Someone whispered behind her. She's assisting on that case. Whitmore's either gone soft or gone mad. She walked past the murmurs, her back straight, her steps silent. The operating room wasn't a place for opinions. It was for outcomes. And today, she had one job, not to shake. The patient was a 42-year-old firefighter with an aortic laceration and pulmonary complications. A bad fall during a warehouse rescue. Every artery mattered. Every second would count. Whitmore didn't greet her when she entered. He simply glanced up, nodded, and motioned to scrub in. No ceremony. Just purpose. Inside the OR, she took her place across from him. To her right, Dr. Patel, returned from the lockdown days ago. He offered a forced half-smile. To her left, Dr. Martha Ellis, the same resident who had called her lucky. Her eyes were icy. Emily swallowed. The monitors beeped. The ventilator hissed. And just like that, the incision was made. 32 minutes in, the room was tense. Retract upward. Careful. You're near the bifurcation, Whitmore instructed. Emily's hands moved into position. Controlled. Her fingers remembered from simulations, from lectures, from that night when a child's life had rested in her hands. But this was different. Too much pressure, Martha whispered. Loud enough for the room to hear. Emily adjusted. Subtly. Whitmore didn't react. But she saw it, the slight twitch of his left brow. He had noticed. He noticed everything. Tran, he said. I want you to expose the branch line. Use the debaki. Now. It was a maneuver she had only practiced on models. Never on live tissue. Never under 8 pairs of judging eyes. She reached. Clamped. Lifted. No tear. No blood surge. No mistake. The silence was louder than any praise. An hour later, the repair was complete. You may close the outer layer, Whitmore said, removing his gloves. Emily blinked. Sir. You've seen it done 3 times. This makes 4. Martha stiffened. Patel looked down. Emily stepped forward. Her hands moved slower this time, not from fear, but from care. Her sutures were deliberate. Her breathing matched her movement. She didn't look up until the final tie was made. Whitmore examined it. Then turned to the scrub nurse. Noted. And walked out. In the changing room, Emily sat on the bench, still in scrubs, staring at her hands. The tremble came now, after the fact. A delayed wave crashing after the tide had already turned. The door opened. Martha walked in. For a second, neither spoke. Then, you know he's testing you, right? Emily didn't reply. Martha continued. It's not praise. It's pressure. He's waiting for you to crack. Emily stood. Maybe. But even if I do, I'll crack doing the work. She walked past her. Some of us didn't need a crisis to prove ourselves, Martha said behind her. Emily stopped. Turned back. No. Some of you just never got noticed because you never stepped into one. That evening, Emily sat alone on the hospital roof. Her shoes off. The city humming below. She thought of her parents, Vietnamese immigrants who had scrubbed their own lives clean to give her this chance. She thought of the sacrifices. The silence. The hours. Then her phone buzzed. Message from Dr. M. Whitmore. Tomorrow. 6:30 a.m. My office. Bring your notes on central vascular anomalies. Emily stared at the screen. She didn't smile. She simply whispered, okay. And for the first time, she allowed herself to believe it. Not luck. Not a fluke. But earned. Emily sat on the bench outside the surgical boardroom, still in her scrubs from the morning's vascular rotation. Her legs bounced. Her hands wouldn't stop twisting her ID badge. Every few seconds, she checked the time on the wall. 7:29 a.m. The door beside her opened. Tran. They're ready for you. She rose and walked in. Around the long oval table sat 8 people, surgeons, educators, and the head of surgical residency admissions. Not a single smile. Dr. Elsner folded her hands. We're here to discuss your placement. Emily nodded, trying not to let her throat close up. For your year, we had 35 applicants. 13 internal. You're ranked 6th. A pause. Your record is clean. Evaluations, average to high. Initiative, noted. Performance during emergency cases, she glanced at a file, distinct. Silence. We are offering you a formal invitation to join the general surgery residency, starting July 1st. Emily didn't breathe for 3 full seconds. Thank you, she said, barely above a whisper. Dr. Leone nodded. This isn't luck. You fought for this spot. You earned it. Then Dr. Whitmore, seated at the far end of the table, finally looked up. No one gets through this program on instinct alone. But instinct got you here. Let that be your compass. Later that afternoon, Emily returned to her locker. Inside was a small envelope. No name. No stamp. Just a short, typed letter on thick paper. You remind me of someone I used to be before the system made me colder. Don't let it do the same to you. Keep your mind sharp. Keep your heart soft. A surgeon who noticed. She stared at the words for a long time, hands trembling slightly. She knew who had written it. Not because it was signed, but because it wasn't. 3 weeks later, her residency began. The badge changed, Resident, General Surgery, Tran. But she didn't. She still showed up early. Still stayed late. Still helped close when no one wanted to. Still noticed when a nurse looked tired or a patient's chart didn't add up. She didn't need headlines or speeches. Recognition had come in the form of trust, from someone who, in the beginning, hadn't believed in her at all. On her first solo shift as a resident, Emily passed by the surgical wing conference room. Lights off. Empty chairs. Then she saw it, written in dry erase on the board, in neat, sharp handwriting. Excellence is silent until it's necessary to speak. M.W. She smiled. Then walked back into the OR. She had work to do.
Thank you for listening to this story. If it moved you a bit, leave something, write a comment, like the video. It helps us grow the channel and create more stories. See you in the next story from Stories for Each Day.